The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone. Welcome to today's webinar, and thank you for joining us. My name is Kate Neal, and I'm the Communications Specialist at the Michael and Susan Dell Center for Healthy Living. Today's webinar is hosted by the Michael and Susan Dell Center for Healthy Living at the UTHealth School of Public Health in Austin. The center's mission is healthy children and a healthy world. Before we get started, I just wanted to make some housekeeping announcements. This webinar is being recorded and will be archived along with the presentation slides on our website at msdcenter.org. If you have any questions during the presentation, please enter them into your questions chat box. We will have time for a Q&A at the end of the presentation. I'll now hand it over to Mike Pomeroy to start their presentation.
Good afternoon, everyone. Happy Friday. Thank you so much for making some time to spend some time with us today to talk about what Brighter Bites did this last summer. When the pandemic first hit, we were faced with resources of how to feed people and families who needed it. And so we're excited today to talk through how we approached that challenge. Before we get started, though, I'd like to introduce all of us. My name is Mike Pomeroy. I am our Senior Program Director of Brighter Bites. I oversee our programming in all 6 cities where we're currently operating, and have had the pleasure of working with our co-founder, Dr. Shreela Sharma, since before the program started at UT School of Public Health, and working with the Dell Center as well. So Shreela is also here presenting. Dr. Shreela Sharma is a professor of epidemiology at the UT School of Public Health and the co-founder of Brighter Bites. And we also have Jacqueline Noyola. She's a program manager of nutrition education for Brighter Bites. And she actually played a really key role in the outreach and the spearheading of this emergency food effort. So I'm excited to have her talk to you about how that went. Before we dive into some of the data that we saw and what we actually did, though, I wanted to set things up with who Brighter Bites is and what we were doing before the pandemic, just to make sure we're all on the same page with that. So next slide, please. Our mission as Brighter Bites is to create communities of health through fresh food, and we do this in schools. We work with elementary schools. Next slide, please. To execute a 3-part program that is delivered to schools and to families at these schools regularly for 16 weeks across the school year. The 3 parts are actual produce distribution. We send home 20 to 25 pounds of a variety of fruits and vegetables with enrolled families at our schools for 16 weeks across the school year. That's the equivalent of 50 servings of food for a family of 4. And at the same time as sending home healthy and nutritious food, we're teaching the children in school via the coordinated approach to child health, or CATCH curriculum, the importance of healthy eating and active living. We're working with teachers in all of our schools to actually implement CATCH in its fullness, teaching the lessons, putting the posters up on the wall, having the activities in the PE classroom, so that there's really a cohesive message in the whole school talking about healthy living and why it's important. And we also try to help families learn how to use the foods, and we help engage parents in why it's important to eat healthy. And we do that in a normal year with our fun food experience, having families, when they come and pick up their sets of bags, we have a recipe prepared for them that uses some of the items that are going home that week. We have a nutrition topic of the week, we have some games for the kids, and we try to make a fun environment for everyone to feel good about healthy eating. And we found that these 3 components, when combined together across the school year for a cohort of families, really makes an impact. We found that through measuring the outcomes. We partner with the UT School of Public Health to consistently administer surveys to our parents, asking them about their fruit and vegetable intake, their health habits at home, and their likeliness to serve fruits and vegetables as snacks to their children. And we have seen some great impacts. Next slide, please. Since 2012, when we started, we've been able to provide over 40 million pounds of produce and millions of nutrition education pieces to almost 500,000 individuals, which represents about 100,000 cumulative families. And that's at over 275 schools across Houston, Dallas, and Austin here in Texas. And we also operate in New York City, in the Washington, D.C. area, and Southwest Florida. Next slide. I mentioned some of the partnerships that were crucial in our beginning. We were born really at the UT School of Public Health with Dr. Sharma, our co-founder, and Lisa Helfman, the founder. Shreela from the beginning has helped us conduct research to determine the program effectiveness on these behavioral and health outcomes that I just measured. At the same time, we at Brighter Bites, our staff regularly tracks our own KPIs. We make sure that we're delivering the program that we talk about on these webinars or in any other setting. We make sure that we're actually delivering regular amounts of poundage, the 20 to 25 pounds, that we're achieving the variety we want, and that families are still enjoying and accepting the program and having the impact that we expect to have. And we're also executing program evaluation on the long-term behavioral outcomes, asking families over multiple years and looking at their behavior changes as they participate in Brighter Bite to determine the real impact of the program. Next slide. Some of the research that we've done has shown that families that participated in Brighter Bites reported twofold increase in cooking meals from scratch and a significant increase in eating meals together and serving more produce as part of those meals. They also reported a twofold increase in using nutrition labels to guide their grocery purchases. This is all as compared to a control group that did not receive Brighter Bites. They also reported a significant decrease in added sugars consumed among the children. And this, we also worked with those same families and followed up with them 2 years later and showed that they were showing a sustained consumption of fruits and vegetables compared to those families who did not participate in Brighter Bites. That even if they weren't participating in Brighter Bites and getting the free produce, they had increased their overall food consumption and had sustained it beyond the program length. So we're excited about that. And I'm sorry, there's one more point here. We've also shown that children who participate in Brighter Bites consume more fruits and vegetables that are served at school lunches. We did a fun plate waste study showing that the kiddos who received broccoli in their bags at Brighter Bites were more likely to eat the broccoli on their plates in the school lunchroom. So we've really shown that the program has some impressive impacts in actually showing behavior change. Next slide. This is just in addition to the data, some of the real world impact of the program is helping parents achieve a variety in their diets that sometimes they felt was prohibitive. Brighter Bites helps families cook things that they wouldn't have bought for fear of wasting money if their children didn't like it. We call it the no risk, the free trial that Brighter Bites provides. You may not know how to cook an eggplant and you may not want to waste your money on it in case your kids don't like it. But if you get it for free, you're willing to take that risk and learn. And then you know how to cook eggplant in a way that your kids will eat it. Next slide. So this is transitioning to you, right, Shreela? Or do I still do this one? I can't see our notes. I apologize.
That's okay. I'm happy to take over.
But I'm sorry. Let me just. I'll take this and then pass to you. I just wanted to. We were delivering the program that I've been describing in early March of this year to 86 schools in Texas and another 15 in our other cities. And we had to abruptly end, of course, when the COVID pandemic hit and schools closed. We were no longer able to use parent volunteers in the way that we had before to pack bulk produce. The schools weren't even able to deliver the regular curriculum, let alone some of the catch curriculum we were trying to push. So what we did was pivot to see how we could best support our families. We administered a rapid response survey to find out what their immediate needs were. And we took our staff time and energy and shifted it toward meeting that need since we weren't able to deliver the program that I've been describing. So I'll let Shreela take it from here to describe what some of that looked like.
Thanks, Mike. So as Mike mentioned, Brighter Bites really had to pivot from the usual programming in the schools to still understand and meet the needs of the families, because the families served through Brighter Bites are predominantly low income. The school eligibility criteria is that 75% or more of the children have to be on a free and reduced lunch program, and the entire school gets the program for free. So through Brighter Bites, they get a substantial amount of produce for 16 weeks, along with the nutrition education for free. So when these school closures happen, the first thought was, well, how do we then still understand and identify the needs, and then use that data to inform next steps in how to meet that need. So to that end, we administered a rapid response survey in April 2020. So it was April through May 2020. And if I'm sure everybody remembers this time when pretty much there was a shelter in place established nationwide in most of the cities. Certainly in the cities where Brighter Bites was operating, which meant that everybody was at home. Schools closed, businesses were shut down, and everybody was working from home, and kids were at home as well. And as we all know, what happens during this shelter-in-place situation is that children who were relying on school meals before the pandemic no longer had that additional food provision as well. And this was also a time when a lot of the government response to the pandemic in regards to food insecurity was also still just being formulated. So we wanted to understand that given this unique scenario that our families were in, and also given that the need was probably even greater at this time, because many of our families also couldn't find work. Those who were, in the restaurant industry or industries that really were dependent on hourly wages type of a thing, those closed temporarily, and many of our families also lost the regular income. So we have several manuscripts that now we have published, and I wanted to put those on here for folks who want to read them. The webinar will be available, and these manuscripts are also available, and these really go in depth into all of the different pieces that we did in regards to assessing the need, and in regards to establishing partnerships that were needed to then address the need, whether those were partnerships between community, other community-based organizations and Brighter Bites, or between academic even other academic institutions and Brighter Bites, and all the pivoting that Mike mentioned that happened as well. So we'll talk through these at a high level in the rest of the presentation, but if folks want to get a deeper dive into it, these are the citations. So just to kind of level set where we were at in taking a step back, pre-pandemic, we were actually doing quite well in regards to food insecurity. We were on the decline, and 10.5% of the households were reportedly food insecure as of 2019 for the USDA Economic Research Service. So there were several years where we went up after 2007, 2008, But then last few years, we were seeing a decline in those rates of food insecurity, which was promising. In terms of what we also know is that households with children experience a greater prevalence of food insecurity as well. So that is even a greater concern among those who are food insecure. And we also are aware of now there's a substantial amount of literature that demonstrates the impact of food insecurity on child and adult health outcomes, which is why food insecurity is of significant concern, because families who are food insecure also engage in disordered eating patterns because of consumption of highly processed, unhealthy foods, or lack of food on a regular basis. And those patterns then increase their risk for diet-related chronic diseases and sort of impacts health outcomes and even outcomes across academic achievement and things like that. So there's a substantial amount of literature now in that space. And so it's definitely a concern for very many reasons, and a high priority for Brighter Bites. So that the USDA tells us what food insecurity looks like in the US. Within the Brighter Bites community, the blue lines are the pre-pandemic data that we collected. As you can see, the prevalence of food insecurity is quite high, even at pre-pandemic levels. So 71.5% of Brighter Bites families at, I'm going to call it baseline, with pre-pandemic, were food insecure. And that is not surprising. In fact, we see those same levels year after year, and that's because Brighter Bites specifically targets schools, as I mentioned earlier, where 75% of the children are in the free and reduced lunch program. So this prevalence of food insecurity is not surprising. However, it is important to note that we are dealing with a highly vulnerable population. If you look at, again, pre-pandemic, what some of the behaviors were, about 13% of the families said they never ate food from any restaurant. So majority of them were visiting restaurants, and majority of them also shopped at large chain grocery stores quite frequently. If you look at what happened post-pandemic or in April, May, which is right when the pandemic hit, so during the shelter-in-place time, food insecurity jumped up by about 20%, 22% to be precise. So a majority of, 9 out of 10 of our Brighter Bites families who responded to this survey said that they were experiencing food insecurity. And the prevalence of eating food from any restaurant, never eating food from any restaurant, went up to 62%. And we all know what happened during that time. Restaurants just closed and were figuring out how they can service their clients. So this is, again, also not unsurprising either. And then, interestingly, the shopping at the large chain grocery stores, the frequency of shopping stayed about the same. So it's decreased slightly, but for the most part, a majority was still shopping at the grocery stores. This is also not surprising. And so, yes, the survey was conducted across all of the Brighter Bites cities. And these results were unsurprising as well in terms of grocery shopping. We all know that the toilet paper madness that happened, but pretty much everybody did continue to get their food from grocery stores. So that did not change either. And again, this data is available on our paper that was published in Preventing Chronic Disease a couple of months ago. We asked the families, due to COVID-19, are you concerned about any of the following in regards to your family? So we asked them, are you concerned about financial stability, employment status, availability and affordability of food? This is availability and affordability of, I believe this was healthcare. I'm forgetting what this is, but access to transportation, childcare, clinic or doctor. And we also asked them about their health status. And as you can see from the results, a significant proportion was concerned about their financial stability. That was really top of the mind, 76%. Employment status was also of concern. But again, second to financial stability, really availability of food was a significant concern as well. So these were really top of the mind for the families. And then about 25% reported that they were in poor or fair health status. And access to their clinic or doctor was a concern among a third of the families. Interestingly, childcare or transportation were not reported to be of major concern, I suppose because everybody was at home and nobody was, very small proportion, at least the ones who responded to our survey, were working outside the home. So that it's hard to collect quantitative data and then not understand qualitatively what is really driving those quantitative numbers. So we actually asked this question at the end of the survey. We asked the families to share their greatest concern at this time, and we asked all the families. And then we did a thematic analysis of the comments that we got, because we got so many comments. Pretty much all of the 1,000 plus surveys that responses that we got had comments in it. And so we ended up doing a thematic analysis. And as we were doing the thematic analysis, it also came to our attention that there was a subgroup of families that were really in crisis mode. And that's what we're going to focus on for the rest of this presentation. So these families were really struggling, not just on COVID-related concerns. They just were on the brink of despair and just really were raising their hand and saying SOS. And we realized at that time that we really had to do a better job at that there were two groups. Let's put it that way. We realized there were two groups. There was one group that needed assistance, but then there was another group that needed assistance now. And there were about 132 families that fell in that category, which was 13% of the surveys that we received. And just presenting a little few of the themes. So there were 4 themes that came to surface in this thematic analysis. One was fear of contracting COVID. And you can see the example comments. My daughter was diagnosed with coronavirus and I'm scared for all members of my family. We are worried that my husband does not have a job. We're very afraid regarding the virus, of taking our children to the doctor, to the dentist, etc. This family was particularly afraid of leaving the home, and they did not have a job. They did not have an income to pay their utilities bills and so on. Then disruption of employment status. I was left without work. and I don't have money for supplies or bills or food. I'm very worried. I haven't had work for 3 weeks, and I don't have money to pay rent, electricity, or water. It's important to note that all of these respondents were Brighter Bites families. They were familiar with Brighter Bites. They had received Brighter Bites programming in all of fall 2019. They knew that Brighter Bites is a health promotion program that focuses on food and nutrition, but clearly they were needing help across all areas. Financial hardship, there were in quite a number of comments for this particular one, mainly associated with, again, paying off their utilities and rent. And we all know what happens with families when those who are food insecure are also struggling with other social needs. And there's a lot of spending trade-off that happens where 1 week you might buy groceries, but you can't pay the rent. And 1 week you might be able to pay the rent, but you won't buy any groceries. So there's a snowball effect in regards to not being able to meet one need. And so these were the financial hardships of these families that were particularly in crisis. And not being able to pay rent and these are households with children, is particularly debilitating, because that means that they would lose housing in addition to not having food and such. So definitely a crisis mode. And then, of course, exacerbated food insecurity, which was related to not having enough money to buy the food. Just to kind of show the sociodemographics of these families that were in crisis, majority of them were from Houston. This is sociodemographics of about 71, so it's half of the families that were, but these were the families that we published the paper on. So these were about 71 families. And you can see majority of them were in Houston, and they some of them were participating in SNAP and WIC, but not all, but majority of them were participating in the free and reduced lunch program, which went away during this time. So that definitely contributed in a big way. A majority of them were Hispanic. 100% were food insecure, and this is some of the data that we saw earlier, but specifically financial instability was overwhelmingly high, and also these families rated their own health, about close to 50% of them rated their own health as being poor or fair. So what did we do in regards to these families? In addition to collecting the data and doing this thematic analysis and identifying these families, in epidemiology, we know that our role doesn't stop until the need is met. Right, and so we used an approach called Rapid Epidemiological Assessment, and this REA has been used quite extensively in post-disaster assessment method to identify and assess a population by using fewest resources in the shortest time. So the time period is particularly important in REA. Because the need is acute, and it needs to be met immediately. Otherwise, it can result, typically when you're doing this an outbreak investigation, it can result in an outbreak. These measures have included are of various types, surveys, door-to-door. We did surveys electronically. And the assessment can be both qualitative and quantitative, and we used both methods, as you guys just saw. We used qualitative and quantitative method. And we are not the first one to actually use this REA assessment for social determinants of health. They have been used, this type of assessment has been used quite extensively during disasters to assess various types of social needs. So there's precedence for this work, but the important component when you're doing this work or you're initiating an REA type of an assessment is you don't want to, you shouldn't stop until you've actually addressed the need. It's not enough to just assess the need. It's important to address the need, and that is part of the process. And it particularly became even further relevant as more data started coming out that those who had suboptimal immune function and health and diet-related chronic diseases actually were experiencing greater complications as a result of COVID. So that further sort of emphasized the importance of this work. So this was so we set up a protocol, an emergency assistance protocol, and this is kind of a schematic going from top to bottom. So you guys saw the qualitative and the quantitative analysis of the survey. And then we triaged to these families to identify those high-risk families. I'll show you the triage criteria on the next slide, but essentially the families had to meet a certain criteria based on their response on the survey, following which a tracking database was separately set up for these high-risk families. And Brighter Bites really, Jacqueline will talk more about this, but Jacqueline and Mike and their team really spearheaded and just did a very aggressive phone banking with these families to get even further details on the qualitative information that was provided. So they followed up with each and every one of these families. That's part of the REA, is that it's not sufficient to get an 80–90% response rate. You really want to get 100% response rate on the phone calls, because each one of those families fall in that SOS category. So Brighter Bites really did a very thorough follow-up with each and every one of these families, and then articulated and deployed a response to the need, which Jacqueline will get into in a minute. And then that response was documented in the tracking database, because you don't stop until 100% of the families are the response reaches 100% of the families. That is the other critical part about doing a REA, is that again, 100% of the families need to be reached and their needs met. And then this continued until all of the families were reached, their response met, and the data documented. So this was the criteria for triage of the high-risk families. Those who responded as being of poor health status on the rapid response survey, they immediately met the criteria for being high risk, or if they indicated in that open-ended question that they were running out of food, diagnosed with COVID, or living with someone with COVID, because if everybody remembers at that time, if you're diagnosed with someone with COVID, you're quarantining whoever you're living with, everybody's quarantining. And since a lot of everything was closed externally as well, it really put these families in a crisis. If they themselves are ill, need assistance, and then a lot related to their living status. So if they're going to lose their place of living, cannot meet the utility needs, or if they've just completely lost their income. So if they met any of these categories, they were classified as a high-risk family, and they immediately went into that tracking database, and then followed up with a phone call to elaborate on what's going on, and a response was deployed. So I'll hand it over to Jacqueline to talk us through the response that was articulated for these families. Jacqueline.
Thank you, Shreela. So as part of our emergency assistance response, we knew that we really needed to establish a framework for addressing the urgent needs of the high-risk families. So I want to go into an explanation of what that looked like. And following that triage, what happened is we established a centralized group of Brighter Bites staff and an amazing student volunteer, which were all trained to make these follow-up phone calls with the families. This really helped us to get the details that we really needed to, and those connection points regarding those immediate concerns and just whatever assistance they needed at the time. It really varied a lot from family to family on what their concerns were. So having that strategy outlined was extremely helpful to have an effective outreach with these families. So as a part of our materials and resources that we used, we started off by first setting up Google Voice for every caller. I think this was really important so that we weren't necessarily using our own phone numbers or private information, but it also allowed us all of the functionality that we needed to connect with the families, which was to be able to make the phone calls, also receive voicemail, and send and receive text messages as well. So that proved to be an awesome resource, which was free and it was easy to install. So it really helped our team to follow up with the phone calls and our messaging with the families. Next, we had an English and Spanish call and text script. We also decided that it would be important to have a cohesive message when reaching out to the families and to let it be known why we were contacting them and that we wanted to get on the phone and talk to them. And so having those resources available and that material in both English and Spanish was really helpful as well for that back and forth. I think there was a really good flow of communications and the families also being familiar with Brighter Bites and us presenting, that we were calling on behalf of Brighter Bites was really helpful for them to be able to go back and forth and to work with us and talk to us and kind of let us into their circumstances, right? And then of course the email template for the delivery of the gift cards itself and our local resources for the families that we put together was really helpful as well. That communication included the information for them to receive their gift card and to be able to use it at the local retail store. Next slide. So after that, Shreela, you talked about this, creating that database, and I really can't stress enough how important that was to have one central place where we were able to document those phone calls and what those interactions looked like, as well as for follow-up to be able to go back to families that we needed to go back to answer questions that we were receiving. So I think having that database in place was really, really important for us to be able to access. And with all of those phone calls and all of those responses, we then assessed as a leadership team so that we could tailor those responses, whether it was for families that needed information about internet services for their kids, also wanting to do schoolwork or for other reasons, we were able to then establish that communication and share with them what those resources were. So that tailored approach really wasn't to be able to go back and talk to the families and let them know what it was that they were needing at the time. So those responses really ranged from providing the immediate financial relief in the form of gift cards to the local retail stores. They always expressed the families how helpful that was for them to be able to purchase what they needed for their families at the time. There was a lot of different questions coming from the families in terms of what they could do with that gift card, what they could buy. We also received questions about if they could use it for gas. And so we were able to utilize that gift card for them to meet the needs that they had at the time. And that proved to be a very helpful resource. The grocery drop-offs to families happened whenever they were unable to leave their homes. So as a part of that script that we established, one of the questions that was asked was if they could, if we sent them that gift card, could they actually use it? Did they have transportation to get to the store? And so when we got the answer that they couldn't and they were unable to do that, we didn't want to just provide a resource that they were not going to be able to take advantage of and go to the store and provide that for their families. And so there were opportunities for us to go and actually drop off the groceries and engage with the families in that way. So next, we provided area-specific resources via text, email, and phone regarding the Brighter Bites community food distribution. So whenever we had our distributions happening, we definitely let them know so that they could go there and take advantage of that as well. We also talked about financial assistance, more accurate information regarding eviction freezes. We had a number of families that were really struggling with that, with being behind on their rent, and so they had questions about that. You know, how can I navigate this time? What can I do to not lose my place of living? And so a lot of conversations were centered around that, and that information was very helpful for the families as well. There were also questions about COVID-19 testing sites, and so we were able to identify near their homes testing sites for them to go in the event that they needed to go and get tested. Also participation in government assistance programs and just other requested information. We had a number of families who also noted that their immigration status was something that kept them from being able to take advantage of some programs. And so it was a matter of really figuring out what their need was and what was local, what was close to them that we could connect them to so that they could take advantage of that as well. Next slide. So I have on here what Shreela mentioned, 132 families were supported through this grocery assistance initiative since the start of the pandemic. And I pulled a quote from a text message that I received for the family that I connected with that I really feel like encompassed what that experience was like to be able to connect with the family. She mentioned, she said, "Thank you very much. I'm about to be evicted from my apartment and I'm just very stressed at this time. And this help is a great relief for me." It was really humbling to be able to connect with the families during such a difficult time, a time of distress. And this really encompasses what that experience was like. Families were struggling, they had a lot of different needs. And I think it was beyond just providing the help and having the infrastructure to reach out to them and provide these resources. There were countless times where families just made it clear that they just appreciated being heard. They appreciated that someone cared about them, that we reached out and that we had these conversations with them and that we were trying our best to connect them to meet the needs that they were experiencing within their families. And it was just really just an enormous opportunity for us to engage with families in a brand new way that we never had before. And I really connected with this in particular, so I wanted to share that with everyone. Next slide, please. And so because we learned that many Brighter Bites families were isolating and leaving their house as little as possible, we also instituted a produce voucher program to help supplement the inevitable grocery trips that they had to take. So in addition to that emergency assistance response, we were also able to provide $25 produce vouchers, which were sent bi-weekly to more than 15,000 Brighter Bites households for fruit and vegetable purchases at partner grocery chains in Houston, Austin, Southwest Florida, Dallas, and Washington, D.C. Next slide. And this is just a picture of some of our families holding up their produce voucher. I think a picture is worth 1,000 words. So it was really a great opportunity to connect with the families during this outreach project. And I'm going to turn it over to Mike to talk more about the redemption rate of what that looked like.
Thank you, Jacqueline. Yeah, this program was special because, as Jacqueline described, we heard we were participating in community food distributions, as I mentioned earlier, and we were trying to get food out to the community. But some families were not able to leave their homes. They had been they were under quarantine, or they had people in their homes that they needed to be extra careful and just didn't feel comfortable leaving their house more than just to go to the grocery store. So this really helped empower families to stay healthy. And their one trip to the grocery store gave them an extra $25 that was exclusively to be used in the produce section. And it was received warmly by all of these families. We saw the 69% redemption rate of the vouchers, which compared to retail coupon voucher rates, our understanding is it's really good. They're really happy to see double-digit redemption of any kind of coupons, and so to see such high redemption of these vouchers both shows that we were effective in reaching the families that really needed to use them, but also that there was such a need there, that this was a really important piece of that. The next slide we have highlights some of the partners that we've talked about in this presentation who have either helped with produce or with funding. I wanted to go ahead and respond to one of the first questions. We do receive funding through the Texas Department of Agriculture as administered through the Texas A&M AgriLife Extension, which is why they're here. So they're one of our local Texas funders. And we also leverage SNAP Ed funding at a federal level. We were not allowed to use any SNAP Ed funding on any of the emergency efforts we talked about today, so they're not featured on this slide, but they're another big piece of how we operate under normal circumstances. We also depend heavily on the infrastructure that the UTHealth School of Public Health provides for us, and Dr. Sharma and her team meet regularly with our team to help guide our decisions, provide data in our strategy. She sits on our board and is just an invaluable resource to Brighter Bites. Obviously, these retail partners have been really crucial in executing the voucher program. We worked with HEB in Austin and Houston, the 99-cent only store in Dallas, and in Winn-Dixie was in Southwest Florida. And then Walmart we worked with in DC and also Dallas. And then in each of our markets, we were supported by our food bank partners. Here in Houston, massively by the Houston Food Bank. In Dallas, the North Texas Food Bank was really important in our efforts. The City Harvest in New York, the Capital Area Food Bank in DC, and Harry Chapin Food Bank in Southwest Florida. And some of these other organizations on the bottom helped us with procuring produce, boxing produce, or providing funds or education for our program. The last slide is information about how you can get in touch with us, but hopefully my co-panelists can join me and we can go over some of the questions that I see filtering through in the chat.
Sounds good. Mike, a lot of these questions are from a programmatic perspective. Do you want me to, how about I read those out to you and you can answer them?
Sounds good.
Okay, so I know you answered the question about TDA, and I answered the question, the survey was nationwide. A question regarding the vouchers, are the vouchers available in Maryland?
Yes, that's where we were able to partner with Walmart for Prince George's County, Maryland, which is the one county where we serve with the Capital Area Food Bank in DC.
And are there any programs in New Jersey, or can you talk a little bit about Brighter Bites expansion and how Brighter Bites thinks, is Brighter Bites open to expansion, I suppose?
Yeah, Brighter Bites was built to be scalable and built to be able to operate in lots of different markets that have food distribution infrastructure to help support it, whether it be a food bank or other food donors or food rescuers. And so we don't currently operate in New Jersey, but we are always happy to have conversations with folks and see if there's a way to take some of the existing energy around these issues in communities, to bring together food producers, food banks, schools, academic institutions to work together to really help benefit those that are in most need in your community. Even if it's not the branded Brighter Bites program, we're happy to talk to you about the things we've learned in building these community partnerships, and you perhaps whatever you're, if that's of interest.
So sorry, Mike, you got cut off. Did you say how they can get in contact with you if that is of interest?
Yes, please send me an email. I'll field any interest about questions about building those partnerships or potential growth. I can get us connected to the right people to have those discussions.
So related to that is whether COVID-19 has changed or paused Brighter Bites expansion plans.
Yes, it definitely paused them. We are hoping to, we are launching in the Salinas Valley of Northern California this coming January. So we had planned on doing that this last summer, but it was delayed. But we've hired a program manager there and are excited to be working to deliver the family program there. And if the vaccine really works and we're able to emerge from this pandemic next year, we are going to proceed with additional expansion plans next year. We were able to grow in some of our cities to increase the number of sites we were able to serve this year, even under the pandemic, because in the pandemic we have this boxed produce method and didn't depend on schools to provide as much volunteer support as normal. So we were able to expand within cities. And then I saw a question about enrollment for next school year. We will be opening up our online enrollment for next school year in early next year. So check for it in January. It's on our website, brighterbites.org/join-us.
And okay, thank you for that. And one question that I can answer is, how long did it take to create the assessment instrument for the REA, and what type of evaluation did you use? So we did a mixed method type of an assessment, and it took us, we actually adapted from an instrument from the RTI, Research Triangle Institute. They actually did a rapid response survey themselves right when the pandemic hit, and that survey was available for public consumption. Brighter Bites survey it's happy to share with whoever's interested the protocol and the survey and our thematic analysis of the qualitative data is also in our paper, but happy to share the survey. But we adapted it from from another measure that was administered by RTI, and then did our assessment. And then the protocol for the analysis of for the deployment of the response was from two of the papers that are cited in this presentation, specifically around rapid epidemiological assessment. So that's what we use to develop our tracking database, and how do we deploy a response, and how do we document the response, and so on. This question is for you, Jacqueline. Jacqueline really spearheads the nutrition education for Brighter Bites. So the question is, what are your plans for reinstating nutrition education or tasting experiences in the school setting?
Yeah, that's a great question. We were actually able to pivot to really leverage technology. So what we did is we actually recorded some of our nutrition education materials to share with teachers during the school year, to just make it as simple as possible for them to still have that learning engagement, still have those brain break moments with their students while they were still participating in the program, because of course it's extremely important for us that students understand why they should be eating those fresh fruits and vegetables that are going home in the first place. So it was really a pivot of our strategies to leverage the technology available to us to make sure that those materials were still readily available for teachers to engage the students in that way. So that's a great question.
Jacqueline or Mike, do y'all want to talk about the app as well?
Yeah, we definitely would encourage folks to download the Brighter Bites app. It's finally ready to go, and it has a way to access our entire suite of over 100 recipes, 100 additional tip sheets, how-tos, which means how to prepare different types of fruits and vegetables, and it's all available for free on both the Android and the iOS stores, as well as the Amazon store, which we didn't know existed before we made an app. It's got a functionality that's just for Brighter Bites parents, but it's available for use for anyone out there, for use in your programs as well. So please share it with your families. There were lots of questions that I wanted to kind of see if we could rapid fire get in a couple easy answers. There was a question about giving food to school lunches. All the food that we provide to families is meant to go home with families. So we definitely collaborate with the nutrition services and make sure that there's alignment in the nutrition education and try to align with the nutritional goals of the nutrition educators there. But the food that we provide goes home with families. I saw another question about how can those listening support Brighter Bites? If you're interested, please visit brighterbites.org/donate. We can always use your support. And you can also come out and volunteer if you're in one of our cities. Feel free to reach out to me or Jacqueline and we can get you connected to that. There's a question about the vouchers. That was isolated for the summer. We're not using them currently, but we are definitely working with our retail partners and considering that a strategy that we can use to help reach families who have difficulties reaching the grocery store. So it's not actively in use right now, but it's something that we consider kind of part of our toolkit. We definitely partner with both public schools and charter schools. We're with a few charter schools in Austin and started with charter schools here. Our only eligibility is the 80% or above free or reduced lunch for the school population.
Have you ever considered expanding your mission into the healthcare field?
We have talked a lot to healthcare providers. We think that there's really an opportunity to show that there is actual physiological benefits to participating in Brighter Bites and that it could help prevent disease. And so we've definitely been in conversations exploring what that would look like, and we're interested in seeing if we can apply the Brighter Bites model to other settings and help achieve the same outcomes.
And yes, the app, in regards to the app, it's available in English. Is it available in Spanish as well?
Yeah, it's fully available in both English and Spanish currently. It'll follow the settings of your phone, or there's a little button inside that you can switch the language.
Yeah. I think we are almost out of time. Kate, is there anything you would like to say? We're happy to answer any other questions via email, and we thank everybody for their participation and spending time with us today.
Yes, thank everybody. As a reminder, this webinar was recorded, so the direct link will be emailed to all of the attendees later this afternoon. And if you have any questions, you can respond directly to that email and I will forward you to the right person. Otherwise, you can see all of their email addresses on the screen right now. Thanks for attending, everyone.
Thank you all.
Bye. Thank you.